Brain-eating amoeba. Have you ever heard the term brain-eating amoeba? What exactly is it? And does it actually eat your brain? The scientific name for this amoeba is Naegleria fowleri. It's a tiny, single-celled organism that's found in warm freshwater and in soil. Contrary to its common name, this amoeba doesn't actually eat your brain. Naegleria infection can cause serious brain damage and swelling that often leads to death. The condition is called primary amoebic meningoencephalitis, PAM. What are the symptoms of an infection? Symptoms of a Naegleria infection can appear anywhere from 24 hours to 14 days after initial exposure to the amoeba. The early symptoms are similar to those of meningitis and can include fever, severe headache, nausea or vomiting. Once the initial symptoms develop, the infection progresses rapidly. Later symptoms include stiff neck, light sensitivity, confusion, loss of balance, hallucinations, seizures. What causes it? The amoeba enters your body through your nose. It then travels from your nose into your brain, where it begins to cause an infection. Contrary to popular belief, you can't develop a Naegleria infection from drinking contaminated water. Infection typically occurs when you're swimming in a warm, freshwater lake or river. You can also encounter the amoeba in other water sources, such as contaminated tap water or improperly chlorinated pools, though this is rare. In addition, Naegleria loves the heat and thrives in warm or hot water, so infections tend to happen during the summer months, especially amid extended heat waves. Where is the amoeba found? The Naegleria amoeba can be found worldwide. In addition to the United States, infections have been reported in Australia, Africa, Asia, Europe, and Latin America. In the United States, Naegleria is mostly found in the southern states where the climate is warmer. However, it's also been found in northern states, such as Minnesota and Connecticut. How is the infection diagnosed? If you think you may have a Naegleria infection, make an appointment to see your healthcare provider right away. Be sure to let them know if you've been in any fresh water recently. Depending on your symptoms, they may collect a sample of cerebrospinal fluid, CSF, for testing. CSF is the fluid that surrounds and protects your brain and spinal cord. It's collected through a process called a lumbar puncture. This is done by inserting a needle between two of the vertebrae in your lower back. A lumbar puncture can provide information on CSF pressure as well as levels of blood cells and proteins, which are abnormal in people with PAM. The actual Naegleria amoeba may also be visible under the microscope in a CSF sample. You may also need to have an MRI or CT scan done on your head. How is it treated? Because the infection is so rare, there are limited studies and clinical trials regarding effective treatments for Naegleria infection. Most treatment information comes from studies within a laboratory or through case studies. One promising treatment is the antifungal medication amphotericin B. It can be given intravenously or injected into the area around your spinal cord. Another new drug called miltefosine appears to be useful for treating Naegleria infections. Additional medications that may be given to treat Naegleria infection include fluconazole, an antifungal medication; azithromycin, an antibiotic; rifampin, an antibiotic, although it may interfere with other drugs used to treat the infection. How to prevent an infection? Infection with Naegleria is very rare, but it's always a good idea to take a few precautions when you're spending time in water. Here's a look at some tips to reduce your risk. Avoid swimming in or jumping into freshwater lakes, rivers, or streams, especially during warm weather. If you do plan to swim in fresh water, try to keep your head above water. Consider using nose clips or holding your nose shut with your fingers. Try not to disturb or kick up the sediment when swimming or playing in fresh water. Make sure to only swim in pools that have been properly disinfected.